Hi, my name is Mackenzie Box, and today we're going to talk about the infectious disease of anthrax. All right, what is anthrax? Anthrax is an extremely rare but serious bacterial illness that is caused by the spread of Bacillus anthracis, a spore-forming bacterium from animals and insects. Commonly, you're going to find this infection in animals or livestock, but humans can contract this bacterial illness by coming in contact with those infected animals or the bacteria itself. And I'll mention this later on, but the bacteria can be found in soil. That's why it does affect animals more so than humans. All right, signs and symptoms of anthrax will or may include severe chest, stomach, or muscle pains, skin formation, such as the picture that is shown, lung disease, respiratory distress, or shortness of breath. And then other symptoms include fever, coughing, sore throat, itching, nausea, and swelling of lymph nodes. And then according to the CDC, infection usually develops within a week after exposure, but it can take up to 2 months. And then with treatment, 55% of infected individuals survive, which I feel like is still pretty low. Okay, Bacillus anthracis, also known as anthrax, is the causative agent for the infectious disease. Bacillus means rod-shaped bacterium, and since it is a bacillus, which is rod-shaped bacterium, it is a gram-positive bacterium, which are classified by a violet stain color, and it is a spore-forming bacterium. All right, virulence factors and pathogenesis. 3 primary virulence factors are an extracellular poly-D-glutamate capsule and toxins, lethal toxin, edema toxin, according to the National Institute of Health. Factors are induced by temperature, carbon dioxide, and bicarbonate concentrations found in hosts. These toxins alter cell signaling pathways in the host that interfere with innate immune responses that allow the continued spread of the infection throughout the body and induce vascular collapse. All right, so diagnosis of anthrax. Ways of confirming anthrax diagnosis. You can do this by measuring antibodies or toxins in the blood. And then you can also take samples such as blood testing, skin lesions, spinal fluid, and then respiratory secretions. Other common forms of diagnosis include culturing, direct fluorescent antibody test, and then phage typing. And then along with that, you can also do CT scans and chest x-ray scans to check for any respiratory problems that are caused by anthrax. Transmission of anthrax and epidemiological data. Anthrax bacteria usually enters the body through a wound or the opening in the skin. With this bacterium, like I said, anthrax is naturally found in soil, and that's why it commonly affects livestock animals or anyone that is around those animals. There is no evidence surrounding anthrax being contagious through person-to-person transmission, but transmission from skin lesions or direct contact with bacterium will cause infection. For example, in 2001, Bacillus anthracis spores were intentionally distributed, weaponized through the U.S. postal system, causing 22 cases, which resulted in 5 deaths. And then other cases in Europe include in 2010, 32 cases were confirmed in the UK, and then 16 cases were confirmed in Hungary, Spain, Romania, and Greece in 2014. So it's still happening today. It's not an old infectious disease. It's still very common, or not common, but it's still happening around the world. Prevention and treatment. Treatment for anthrax, taking antibiotics for a long period of time. So that would include penicillin, doxycycline, and ciprofloxacin. And then for inhalation anthrax, it's a lot harder to treat, and this is the more life-threatening type of anthrax. So a lot of people result in antibiotics such as ciprofloxacin, along with other medications to treat respiratory symptoms. And then there is a anthrax vaccine. It is called BioThrax vaccine, which includes 5 doses that are administered over an 18-month period. And then early prescription of antibiotics will prevent the infection to spread more. All right, thank you so much.